Sure. Hi, my name is Trent Wang. I'm an assistant professor of clinical medicine at the University of Miami. This study that we did in collaboration with Dr. Sophie Pachesny was looking at whether or not biomarkers can predict graft versus host and ultimately the chance of dying after a transplant early using samples collected from blood at day 14 and day 30, in particular in this mismatched unrelated donor transplant population. So in mismatched unrelated donor transplant, we really want to see using this novel GVHD prophylaxis regimen with post-transplant cyclophosphamide, whether or not serum biomarkers, especially ST2, were still relevant in predicting adverse events. So we used our retrospective biobank from the University of Miami to assess these outcomes, and we compared what happened with antithymocyte globulin treated patients to those with the newer post-transplant cyclophosphamide treated patients. Yeah, we were happy to see that ST2 still has a good predictive value for a non-relapse mortality, meaning dying from something that is not relapse, including graft-versus-host-disease. So it's really remarkable to think that something in a blood test as early as day 14 or day 30 can predict what happens to a patient by 1 year. And although we don't really have a solution to how to modify this is the first step in terms of getting to that ultimate goal, which is how to intervene and reduce that risk. So Dr. Sophie Pachesny is also leading a prospective trial looking at ST2 biomarker analysis on day 14 and day 17. This includes matched as well as mismatched patients. We also included patients that are treated with post-transplant cyclophosphamide. This is currently accruing at 3 sites, including the Medical University of South Carolina, Fred Hutch, and the University of Miami. And we're excited to see how these results will ultimately fare in a prospective manner that'll hopefully validate some of the findings that we see in our retrospective analysis.